Okay, let's dive right into this explainer and demystify the actual microscopic mechanics behind one of the absolute most painful inflammatory diseases a human can possibly experience. We're talking about gout. We're going to look closely at what's happening inside the body, right down to the cellular level, to cause such immense agony. And most importantly, we'll see exactly how we can stop it. Imagine waking up from a deep, restful sleep. You haven't stubbed your toe, you haven't injured your foot in any way, but you're suddenly struck with a pain so intense, radiating right from the base of your big toe, that you immediately know something is terribly wrong. It literally feels like the joint is on fire.
This specific, agonizing presentation right at the base of the big toe actually has a name in the medical world. It's called podagra, and it is the absolute hallmark of a gouty attack. It usually strikes the first metatarsal joint of the foot, turning what was a totally normal, healthy joint into a swollen, throbbing nightmare in just a matter of hours.
To really wrap our heads around this condition, our explainer today is broken down into 5 key parts: the midnight fire, the uric acid villain, how crystals actually form, taming the flame, and finally, preventing long-term damage.
All right, let's kick things off with part 1, the midnight fire.
Getting a grasp on the sheer severity of the symptoms really puts the microscopic chemistry we're going to talk about later into perspective. The inflammation in a gouty attack is so intense and it happens so fast that a joint becomes red, hot, tender, and incredibly swollen almost out of nowhere. It gets so hypersensitive that even the resting weight of a simple bedsheet across your foot can feel like a crushing, agonizing weight. No joke. The pain peaks in the hours right after the attack starts, but that terrible discomfort can linger and completely debilitate someone for days or even weeks.
And while podagra in the big toe gets all the fame, gout absolutely isn't limited to just that spot. That same inflammatory fire can completely take down other joints, especially those with slower blood flow. We're talking about your ankles, knees, wrists, and even elbows. Any of these can become ground zero for an unexpected gout attack.
Which brings us to part 2, the uric acid villain.
So what's actually causing this internal fire? Well, to figure that out, we have to zoom way in and look at our body's chemistry. The exact biological pipeline that creates this extreme pain starts with something called purines. Purines are basically nature's most common nitrogen-containing compounds, found naturally in our DNA and RNA. Now, when our cells naturally break down, these purines are converted into uric acid. Normally, this is just filtered out by the blood and you pee it out. But here's the catch. At our normal body pH of about 7.4, uric acid loses a proton, becomes a urate ion, and binds with sodium. If there's just too much of it floating around, it forms monosodium urate crystals. And these aren't some soft, harmless compounds. They are literally sharp, microscopic needles.
The absolutely crucial thing to remember here is this specific number, 6.8 milligrams per deciliter. You see, uric acid has limited solubility in our body fluids. When your uric acid levels push past this specific threshold in your blood, it precipitates out. Think of it exactly like stirring way too much sugar into a glass of iced tea. Eventually, it just stops dissolving and crystallizes right at the bottom. In your body, those crystals drop right out of the blood and settle into areas where blood flow is sluggish, like your joints and your kidney tubules.
This state of having excess uric acid has a medical term. It's called hyperuricemia. It's the foundational condition that even makes a gouty attack possible in the first place. Without hyperuricemia, those microscopic needles simply cannot form. So the big question we have to ask ourselves is, why do our uric acid levels spike past that threshold at all?
Let's explore that in part 3, how crystals actually form.
So, what exactly triggers our bodies to cross that dangerous 6.8 line and start assembling those tiny needles? Biologically speaking, the triggers fall into 2 main buckets. Think of your body like a bathtub, with the faucet running and the drain wide open. Hyperuricemia happens if the faucet gets turned up way too high, meaning your body is suddenly producing too much uric acid. Or it happens if the drain gets clogged up, meaning your kidneys aren't clearing it out effectively anymore.
There are quite a few common things that mess with that biological faucet and drain. For starters, eating a purine-heavy diet, think shellfish, anchovies, organ meats, and a big red meat steak, directly cranks up production. So do drinks packed with high fructose corn syrup. On the flip side, dehydration and knocking back alcohol decrease your clearance, which effectively plugs that drain. Then there are medical triggers too. Things like chemotherapy or radiation cause cancer cells to die off faster than normal, which dumps massive amounts of purines right into the bloodstream. Even some everyday medications, like thiazide diuretics and aspirin, can throw these levels completely out of whack. Plus, some folks just have a genetic predisposition to overproduce uric acid from day one. And here is the tragic, brilliant irony of a whole gout attack. Once those sharp little crystals settle into the joint, your immune system spots them and goes, uh-oh, there's a problem. So your well-meaning white blood cells, or leukocytes, rush into the joint to help clean up the crystals. But in the process of trying to help, they release these pro-inflammatory chemicals, including cytokines. So it's actually your very own immune response, this chemical warfare waged by your own white blood cells, that causes the agonizing red-hot inflammation you're feeling.
Moving right along to Part 4, Taming the Flame.
Thankfully, because we know exactly how this mechanism works, we also know how to disrupt it. Making sense of gout treatments gets so much easier when we separate the immediate fire from the underlying fuel. To tackle the acute attack, the goal is simply to drop the pain and swelling fast. For that, we use NSAIDs like ibuprofen or naproxen, or sometimes corticosteroids. We can also use a drug called colchicine, which actually stops those white blood cells from migrating into the joint in the first place. Pretty clever, right? But to fix the chronic underlying issue of hyperuricemia, we have to use totally different tools. We use xanthine oxidase inhibitors like allopurinol to stop the specific enzyme that breaks purines down into uric acid. Or we use uricosuric medications like probenecid, which essentially force your kidneys to excrete way more uric acid. Basically, one stops the faucet and the other opens the drain.
Finally, Part 5, Preventing Long-Term Damage. Treating one single agonizing attack is one thing, but we really have to consider the severe consequences of just leaving hyperuricemia completely unchecked over a lifetime. If you ignore the underlying chemical imbalance, those repeated attacks develop into a truly devastating condition known as chronic gout. At this stage, it's not just temporary pain anymore. The constant inflammation literally destroys the joint tissue, leading to arthritis and permanent deformity. The body also starts storing massive crystal deposits right along the bones beneath the skin. These visible, bulging nodules are called tophi, and internally, it's even worse. People are at a very high risk for dangerous uric acid kidney stones and something called urate nephropathy, where those sharp crystals deposit directly into the kidney tissue itself.
But hey, you are absolutely not powerless here. Taking control means modifying your daily habits to fundamentally alter your body's chemistry. Look at these super effective lifestyle tweaks. First, staying very well hydrated with water keeps the kidneys flushing smoothly. Reducing or just completely eliminating sodas and alcohol prevents those massive spikes in production and stops clearance issues. Cutting back on red meat and seafoods starves the body of the raw purine materials. And finally, staying active to keep obesity and diabetes at bay is absolutely crucial because both of those are major risk factors that seriously complicate your body's metabolic balance.
As we wrap up this explainer, I want to leave you with a thought to chew on. Now that you can visualize exactly how these microscopic needles form from the breakdown of your food in your own cells, what simple choice are you going to make today to keep your joints crystal free? Whether it's opting for an extra glass of water over a soda, or maybe swapping out that heavy steak dinner, the power to tame the midnight fire is quite literally in your hands. Thanks for tuning in, and keep learning.